Oh, we are live. Oh, we are live. Good evening, everybody, and welcome to our talk. It's called technology. Sometimes it fails. So, and the traffic of Nairobi also is very interesting. So those are the two issues. But anyway, here we are this evening again to give some knowledge to people who might need it to make good choices. To my left here is my tech guy, Marion Wakahe. She's usually the tech guy, and she's very good at it, but sometimes the computers have their own mind. I'm Dr. Jane Wakahe, and I'm an obstetrician gynecologist. We speak from a place called She Chooses to Live Initiative, and that's an organization that wants to give knowledge to as many people as they can get, especially matters reproductive health, so that people are able to make choices, informed choices about life, and then choose to live, not just to exist, but to actually live full, fulfilled lives, not to lose chances and such things. So we address many things. We address young girls, we address young men about sexuality, about sexually transmitted diseases, and many, many other things. And whatever it is that you want us to address, as long as it's usually matters reproductive health or matters associated with reproductive health, things like diabetes and high blood pressure in connection with reproductive health, we shall address. Just ask us to do that, and then we shall address. So this evening, we want to speak about something that is very common in to many people, and it's called uterine fibroids. A lot of people have asked for us to talk about it. So I'll spend a few minutes, not very long, a few minutes talking about uterine fibroids. And what are uterine fibroids? These are new growths. By new, I mean that you are not born with them. When a girl child is born, they do not have fibroids. So these are things that grow later, that grow a bit later in the uterus of mature girls. They are usually quite a number. They are usually not one, they are usually very many, and they are in different stages of growth, so that some are bigger, some are smaller, and if somebody is prone to getting them, they are always growing. They are made of muscle, uh, meat, real meat, but very, very tightly packed meat, so that they are a bit different from the muscle that makes the uterus, and therefore it is possible to differentiate them from the normal uterine muscle either during surgery or by the checkup of ultrasound. So it's possible that they are a bit different. They are made of muscle, but they are a bit harder muscle, very, very, very concentrated. In fact, once you remove it, it looks like a big, hard potato, Irish potato. Sometimes even sweet potato. They can be all kinds of shapes and sizes. They're usually contained in a sort of capsule, in a sort of pocket, so that when they are being removed, it is possible to actually demarcate them and separate them from the rest of the uterus. So those are fibroids, things that grow in slightly older women and not born with. And so they are called new growths. They come later in life. Now, who gets fibroids? Potentially every woman who has a uterus has the potential to get fibroids. In fact, by the age of 50, 40% of all women will have developed some fibroids, some few fibroids here and there. So it is a very, very common kind of occurrence. However, having said that, there are some people who are more prone to getting fibroids than others. And this goes with some associations. For example, age. It is unusual to get fibroids before the age of 25, Although having said that, I have removed a very, very huge fibroid from a 20-year-old girl. But it's a bit unusual to get fibroids below the age of 25. They usually will come at age 30 and above, and then grow quite slowly or rapidly. The other thing that they're associated with is children, parity. Women who have had no children, who haven't delivered any child, are more prone to getting fibroids than people who have delivered many children. And when we talk about parity, we don't just say those who have no children whatsoever. We also talk about those who have few children, and not only few, but those who space their children very far apart. For example, if somebody is spacing their children 5 years, 5 years, 5 years, even if they get many children, they are likely to develop fibroids in between the deliveries. So to those are people with children. Now, the other thing that is associated with uterine fibroids is actually being a Black woman. The Black woman is more prone to getting fibroids than the white woman or the Asian woman. So you tend to find them in African women, in Black women, wherever they are found in the world. The other thing that they're associated with is genetics. They tend to run in families, so that in fact, if a woman has fibroids, her daughter stands a 3 times chance of getting fibroids as compared to the rest of the community. So it runs in families. In fact, you will find your cousin or your auntie or your mother had fibroids if you are getting fibroids. And if you have relatives who have fibroids, it's a good thing to keep an eye and check whether you are developing fibroids. The other thing they're associated with is starting periods early. If a girl starts periods by the age of about 9, then they are more likely to actually develop fibroids than those who start their periods much, much later. They are also associated with obesity. People who are obese, women who are obese, they tend more likely to get fibroids than women who are not obese. Or who are normal size or even smaller. Now, the other associated thing with them is diabetes. So women who are suffering diabetes are again likely to develop uterine fibroids than the rest of the community. Women who have polycystic ovaries, I think we discussed this at some point, and we talked about how polycystic ovaries bring some fertility. But women also with polycystic ovaries tend to get more commonly fibroids than the rest of the women. And the other thing that is associated with them is high blood pressure. The high blood pressure that comes from what we call essential high blood pressure that is inherited, not high blood pressure that comes because of some organ failure or anything like that. But if somebody has a family history of high blood pressure, they are likely to also get uterine fibroids. Now, how does one know they have uterine fibroids? What are the signs of uterine fibroids? Much of the time, absolutely no sign. In fact, most fibroids are diagnosed incidentally when we are looking for about something else, and you even also have fibroids in the process. So most of the time, there are no signs and symptoms to tell you that one has fibroids. But if the signs are there, then these are the ones that there can be a bit of swelling of the lower abdomen. In fact, the girl I removed, the 20-year-old girl I removed a big fibroid from, their parents were very unhappy with her because they thought she was pregnant, and she declared she was never been pregnant. She can't be pregnant. And they wouldn't believe until we did an ultrasound, and truly she wasn't pregnant. She had a huge fibroid. So she was swollen like she's pregnant. So swelling of the lower abdomen. Now, the other thing that increases is the bleeding. Some women get much, much heavier menstrual flow so that it even can lead to anemia. So if a woman has anemia, one of the things to investigate and to ask is how heavy are their periods, their menstrual flow, their monthly flow, and if they are very very heavy, then we also check for fibroids. Now the other thing that they do is they make somebody get what we call frequency of passing urine. This is because the uterus enlarges and it's somewhere where they share space with the bladder. So the uterus does, if it is large, it doesn't allow the bladder to fill up completely with the with urine. So one feels a little, the bladder gets a bit full, and one has to go and empty it because it feels totally full. The other thing is one can feel lower abdominal pressure, like there's something always pressing in the lower abdomen, whether seated, whether standing, then there can be quite a bit of abdominal pressure. If that happens, then one needs to check for fibroids. Another thing is actually constipation, because sometimes the fibroids are sitting on the area of the rectum, and if they do that, then they can cause quite a bit of constipation. So constipated women also need to check out, do they have fibroids? And then finally, what is called dyspareunia. Dyspareunia is painful sex. When having sex, then it can be quite painful because there is this solid thing that is in the way of having sexual intercourse, and it can be quite painful. So painful sex is something else that is associated with the uterine fibroids. Now, how do we diagnose them? Physically, one gets to feel them. Your doctor will check you out and feel them, but the confirmation is actually by ultrasound. And the ultrasound is necessary for a few things. One, it will tell you how many fibroids you are carrying around you. And two, it will tell you how big they are. They do the measurements and tell you in centimeters how big the fibroids are. It will also alert you, the doctor, as to what position the fibroids are in. There are various positions of the fibroids. I'll talk about that a little bit later. So it will tell you what position the fibroid is in. And more importantly, there will be an answer as to whether this big swelling that is in the pelvis is blocking the flow of urine from the kidneys. So when somebody has uterine fibroids, as we are doing ultrasound, we need to request that as you are checking the size of the uterus and the location of the fibroids, kindly also check the kidneys, because that is one of the biggest problems. The kidney is found behind the lower rib at the back, and it has a pipe called the ureter that takes urine all the way to the bladder. And sometimes when the fibroids are big, they'll sit on those ureters and kind of block and make a dam of the urine and make the kidneys unable to flow, in which case it's actually very, very dangerous for the health of the person. So when we are doing ultrasound, we check the kidneys at the same time as we are checking for the fibroids. Now, I said there are different positions of the fibroids in the uterus. The fibroid can be inside the inner side. They are all found in the muscle of the uterus, but one of the times they can be found going inside towards where the baby lives. So those ones are the ones that cause bigger surface area where the baby lives, called the endometrium. And those are the ones associated with a lot of heavy bleeding if they are abutting, if they are pushing into the endometrial cavity. Then there can be others which are completely contained in the muscle of the uterus, which sometimes, other than their largeness, they have no big problem. There are others which are towards the outer side of the uterus, again with no very big problem except pressing on other organs. And there is a final one called pedunculated. It hangs like it is on a string outside the uterus and can be rolling around like a golf ball around the intestines there. So there are those pedunculated ones. Let me take a bit of water. And now talk about fibroids and pregnancy, because I think that's where most people are particularly interested in. And what can fibroids do about pregnancy? One of the things that fibroids can do is cause actually infertility. If a fibroid is sitting inside the endometrial cavity where the baby lives, then the uterus can decide that it's already occupied with a baby and refuse to implant another baby. So that's a way that it can cause infertility. The other way that fibroids can cause infertility is if they sit near the fallopian tubes and block them. Now, the fallopian tubes are necessary for the connection between the sperm and the ovum. If they are blocked by huge fibroids, then there is no connection between the two, and the pregnancy cannot happen. So they can cause, that's one of the things that fibroids can do. They can cause infertility. The other thing they can do, fibroids in pregnancy, is to cause miscarriage. And this is in two ways. If a baby implants on a fibroid, the fibroid is a very interesting thing. It's a very, very solid muscle, and it's not got a lot of blood supply. So if a baby was to implant on the fibroid, then the baby may not be able to get enough blood supply and may not be able to grow, and the baby would miss and may be miscarried. So that's one of the ways that fibroids cause miscarriages. And the other way is if the fibroids are so large that the baby is unable to push them around, and then the baby is squashed and made unable to grow, and finally they are miscarried. But actually, most of the times, the fibroids have no effect on the pregnancy. Many a time, the baby will coexist with the fibroids. The baby will push the fibroids aside, and the baby will actually continue to grow if they get enough blood supply to the to the baby. If the baby gets enough blood supply, they'll continue to grow and be able to push the fibroids aside. Now, what happens to the fibroids when there is a pregnancy? When one is pregnant, there is a lot of blood supply into the uterus. In fact, a quarter of the blood is sent to the uterus to be able to supply the baby with food and oxygen. And for this reason, the fibroids take advantage and really grow. So as the baby is growing, they also grow very, very fast. This develops into two things. One is that it can grow so much and outgrow its own blood supply, the fibroid, and it starts to rot inside, what we call red degeneration. It's just not being supplied with enough blood to keep it going, and it gets red degeneration, and hence can get very, very painful indeed. So fibroids can grow very, very large when one is pregnant. And the other thing they can do is they are really painful, very, very painful indeed when they do that, when they grow like that. Now, if one has a large fibroid, then there is some associations of pregnancy that we want to discuss a little bit about. When somebody is found to have fibroids, the things to look out for is something we call abruptio placenta, because women with uterine fibroids have a bigger tendency to get abruptio placenta than other women. Abruptio placenta means that the placenta separates from the mother. Placenta is usually attached to the mother very nicely and gets food and oxygen from the mother, but sometimes it can separate and that becomes abruptio placenta. And that means that now the baby is not being able to be supplied with oxygen and with food, and sometimes quite a number of times abruptio placenta will end up with fetal demise and quite a dangerous situation for the mother. So if somebody has excessive pain when they are with fibroids, not only do we imagine that it is the red generation of the enlarging fibroid, but we have to quickly check that it is not a rupture happening to the placenta, and hence causing danger both to the baby and to the mother. The other thing that is associated with fibroids in pregnancy is they get to give the baby what is called intrauterine growth retardation. The baby does not grow as well as babies who are developing in uteruses that don't have uterine fibroids. So the baby may need to be removed a bit earlier if the growth retardation is very severe, and we need to keep an eye on the baby as when somebody is carrying a baby with fibroids. The fibroids are also associated with premature delivery, preterm delivery, so that to get to term with huge, especially if they are very huge fibroids, then it's a bit more difficult. So expect sometimes to get preterm delivery. The other thing is the abnormal lying of the baby. The baby normally lies with the head down, uh, and the bottoms up and the legs up. That's how the baby is normally born in a normal way. When there are fibroids, because the cavity of the uterus is not nicely smooth, then the baby can be lying in any direction. They can be lying with the bottoms down, they can be lying with the head across, they can be lying in any direction. So fibroids are associated with the abnormal lie, what we call abnormal lie, abnormal position of the baby. Now, depending on where the fibroids are, and depending on the effect that they have on the passage of the baby at delivery, your doctor will discuss with you whether it is possible to deliver normally. Much of the time, if the baby is lying nicely and the fibroid is a bit up from where the baby's head will pass through, what we call the lower segment, then it is possible to deliver normally. But that one, you will be advised by your doctor which way to deliver. The only thing I would want to alert us is, because I get asked a lot of the time, if one has fibroids during cesarean section, they will not be removed at that time. And the reason is that the blood supply to the uterus is so much that if we try to remove fibroids, we could cause a lot of bleeding. So fibroids are not tackled during cesarean section delivery. In fact, we wait until the postnatal time, until the effects of pregnancy are gone, before we can deal with fibroids. So do not expect that the fibroids will be tackled at the same time if you're going for cesarean section as the baby is going to be removed, because that would be a very, very dangerous condition indeed. Now, let's talk about what happens after delivery. After delivery, whether it's a normal delivery or cesarean section delivery, the uterus, even when it has not got fibroids, a uterus that had become so big to contain a 3-4 kilo person shrinks to become like a pear, a little pear. So alongside with it, most of the time, actually, the fibroids do shrink as the uterus is going back to normal. And sometimes when one has delivered 1 or 2 children alongside with fibroids, then they don't even need to have anything done to the fibroids, because a few times the fibroids will shrink alongside with the uterus. But a number of times, of course, the fibroids will still remain, and they will need to be dealt with if there is reason to be dealt with them. Now, what happens to fibroids after menopause? Fibroids are found in the reproductive age, from age 18 all the way to menopause. If somebody hasn't developed fibroids by the time they reach menopause, they will not develop fibroids. If somebody already has fibroids by the time they reach menopause, the fibroids will not grow bigger. When during the reproductive age, the fibroids keep growing bigger. Some grow faster, some grow slower, but all of them keep growing bigger and enlarging in size. But the minute one reaches menopause, then the fibroids stop growing there. A few will actually shrink with menopause because of the lack of hormones. And a few will do what is called calcification. They'll become like hard stones in, in menopause. So if fibroids are like small, less than about 4 centimeters or so, and one reaches menopause, then one doesn't really have to really worry about them. But if they were larger than that, then one needs to keep an eye even after menopause, because if they don't shrink, then the presence of fibroids after menopause is a bit different from the ones of before menopause, because before menopause, fibroids are actually what we call benign. They have no harm except they are big and they cause pressure. But after menopause, if they grow, they continue to stay on, and if they are very large, there are chances that they could actually turn into cancer after menopause. In fact, the chances of fibroids becoming cancer during reproductive age is less than 1%. But once you reach menopause, then the percentage goes quite a bit higher. So if one had fibroids, even though you reach menopause, it is good to keep checking that they are not changing in all kinds of directions. And to make sure that they are dealt with in time. Now, I don't usually talk about treatment of things in this forum, but this time I'll talk about treatment of fibroids, because there is so much controversy about it that I need to talk. I'll not go into the deep details, but I need to tell us a bit about the treatment. And what is the treatment of fibroids? And sometimes none. You don't have to do anything about fibroids. But if you need to do something about fibroids, then what is required is surgery. I have heard a lot of people say they are taking herbs, they are taking something. I've not yet seen, in my 36 years as a gynecologist, I have not seen any fibroids shrink because of herbs. There are some medicines we give, as doctors, we give to try to not to shrink them, to try to remove blood supply from them before we do surgery. That is not shrinking them. We just reduce the blood supply so that when surgery is being done, then bleeding is not so much, because there is quite a bit of bleeding when removing fibroids. So that is not the same as taking concussions. And the minute we stop giving that medicine, if surgery is not done quickly, then the fibroids regrow again and regrow very fast. So there is the way to manage fibroids, if they must be managed, is surgically. Now, there are two ways of managing them. If one is old, like you are about, uh, old is relative, of course, you can't be my age, but if you are above 40 and you are not wanting to have more children, then maybe the way to go around it is to remove the whole uterus with the fibroids. Normally, we would remove the whole uterus with its fibroids and leave the ovaries there, so that the menopause will reach when the time that you are supposed to reach menopause, not before. So that's one of the ways that a doctor may tell you, depending, you will discuss with your doctor and they'll tell you maybe the better way, and you will both agree that maybe the better way is to do to remove the whole uterus with its fibroids and leave the ovaries there. Now, the other way of dealing with fibroids is what we call myomectomy. Like I said, the fibroids are contained in a sort of capsule, a sort of wrapping, so that it is possible much of the time to actually remove the fibroid and leave the uterus intact. Now, this depends on the size of the fibroids. If, of course, they are very, very huge, then it is not possible to remove them and leave the uterus alone. But it is possible to remove actually very, very many fibroids, to dig them out like you are digging out potatoes, and dig them out and dig them out, and then leave the uterus intact. That is if we want to continue fertility. Now, the two things to remember about when we remove only fibroids, when we do only myomectomy. And one of them is that fibroids tend to regrow. Not the ones we removed. Those are not the ones which grow. But the uterus which makes fibroids has a potential to make very, very many fibroids, so that it is how shall I put it? It has the potential to make very many fibroids, so that the sorry, I got interrupted by a phone there. I didn't know it was on. So the fibroids there are others that will grow, and many a time we have to do myomectomy on many, many times in the same woman, so that if she is done myomectomy now and she later on in another 5 or so years, she might need myomectomy again. So that's one thing to remember, that other fibroids could grow. The other thing to remember, and this is very vital, is that because we are preserving this uterus for fertility, if you do become pregnant and you have had myomectomy done, you will please deliver by cesarean section. The kind of damage we do when we are trying to remove fibroids, as a rule of thumb, is such that the uterus can no longer take the stress of labor, and it would need to deliver by cesarean section before the onset of labor. So if somebody has had myomectomy done, and by God's grace they become pregnant, because that's why we are preserving that uterus, then the arrangement will be made for them to be delivered before they go into labor. Now, those are the two things to remember if we leave your uterus in there. Now, when must there be intervention over fibroids? Like I said, many a time you don't have to do anything about fibroids, really, nothing whatsoever. You can coexist with them, and they will shrink as you deliver, they shrink, or you reach menopause and they calcify and they become small. But there are times when there must be intervention about fibroids, and these are the times when they are what we call symptomatic. If fibroids are such that they are causing so much bleeding that one is going anemic, then one is in danger, and that time we need to intervene and remove either the fibroids or remove the whole uterus, depending again on what you agree with your doctor. The other thing that makes us remove fibroids is if they pain. Fibroids must not pain. Fibroids actually do not pain. If fibroids start to pain, except in pregnancy they pain a lot. But outside pregnancy, if fibroids start to pain, then they could be doing what is called degeneration. And one of the degenerations is degeneration towards cancer. So if fibroids start to pain, kindly, they need to be dealt with. They shouldn't pain. And then, of course, finally, the pressure symptoms. If the fibroids have become so big that they're sitting in your lower abdomen, sitting and causing blockage of the ureters. Ureters are the pipes that drain urine from the kidneys. If they are seated there and they are causing pressure on the ureters and the kidneys are not flowing very well, then the fibroids have to be removed to make way for the ureters to flow. Because if you do not do that, then you make back pressure into the kidneys and you will actually destroy your kidneys. And you're destroying your kidneys for something that could have been dealt with, that could have been removed. And once you destroy your kidneys, of course, you know how bad it is. You will need kidney transplant. You forever be on dialysis. So we don't want to destroy kidneys when it is something like fibroids, even if we are trying to preserve fertility. So those are the times that fibroids must be dealt with. Like I said, much of the time you don't have to do anything about fibroids. But if they are causing anemia, if they are causing pressure symptoms, if they are degenerating, then you need to remove them, because degenerating may mean that they are becoming cancerous, and that is not a good thing to have. Now, what are we to remember after all this? We are to remember that fibroids are benign growths. They are new growths that happen when after somebody has been born. They are not born with them, so they are new growths. They are the normal fibroids. Again, I said they do not cause bleeding in between. They can cause heavy bleeding when the period comes, but they do not cause bleeding in between periods. So if there is something that is causing bleeding in between periods, kindly check it out. Or if there is bleeding after sexual intercourse, kindly check it out. It's usually not the fibroid. Now, having said that, there is one type of fibroid that can cause bleeding in between um, periods, and that is if it is a fibroid that is usually what we call pedunculated inside the uterus, and it is like a baby, and it's usually born. It's usually the uterus contracts like it's delivering a baby and pushes it out through the cervix. And if the fibroid is the polyp is pushed out through the cervix, then it can be either infected or it can be traumatized, and there can be bleeding in with fibroids. Now, this fibroid looks very much like cancer of the cervix. So one may peep at it and find some mass that is some solid that is rotting in there, and that is likely to one has to differentiate it with the cancer of the cervix, but that's usually a benign fibroid that is being born through the cervical canal, and that is being eroded and causing funny bleeding. Now, there are some things that one should avoid if they're having fibroids. Some things that you should totally avoid. And those are, number one, it's hormones. Any hormones will make fibroids grow bigger at a faster rate. And in fact, that's why they grow during the reproductive age, because that's when a woman has hormones. So you avoid all kinds of hormones, and especially the contraceptive pill. It has quite a bit of estrogen. So if you're having fibroids, please do not use hormonal contraception. Now, the other thing that one needs to avoid is excessive red meat intake. Now, I'm not saying you do not take red meat like once in a week, but do not take excessive red meat. Red meat is again vital because it's the only source we have of vitamin B12. So I cannot say that don't ever take red meat, but try to avoid excessive intake of red meat. The other thing that helps fibroids to grow faster is intake of alcohol. So if you have fibroids, try to not take alcohol. And the other thing is our usual one, the dairy products. The dairy products all tend to make fibroids grow much faster. So avoid those, avoid hormones, avoid red meat, avoid dairy products, avoid alcohol when you have fibroids. They do not bring fibroids. They make fibroids that are already existing grow faster. Now, finally, how do we prevent fibroids? Uh, One, of course, you need to be born in a family that doesn't have fibroids, but you can't swear you don't know where you're going to be born. So the only way to prevent fibroids is from the age of 18 years. You will make a baby, you will deliver a baby every 2 years from age 18 until you hit menopause. I don't know how many babies those will be, but that is the only way of trying to avoid fibroids. Because fibroids, in fact, when you are pregnant, the minute you deliver, the fibroids shrink and they will not start to grow again. They will not start to enlarge again until about 2 years after delivery. So you see, if you make a baby every 2 years, you are likely to end up not getting fibroids. So that's how to prevent yourself from getting fibroids. Just populate the earth like you are told to come and be fruitful and populate the earth. Now, I think I've talked a lot. So let me take a sip of water and call my tech guy. We look for any questions. Tech guy, she's coming. Yes. I told them to make a baby every 2 years, from age 18 to menopause.
You didn't make a baby every year. Every 2 years.
Any questions?
Let's see. Over here, there are no questions. But I saw somebody had posted a question. Maybe you've already discussed it. What are the early signs of you're getting fibroids?
None. There are no signs of fibroids. Actually, none. It's only later when they are bigger that they cause pressure, or if they are causing a lot of heavy bleeding, if they're inside the uterus. But at the beginning, none. Like I said, we actually, most of the time, we discover them incidentally when we are looking for other problems. But fibroids are not very bad things. I always tell people that it's you refuse to give the uterus babies, it makes its own. So the way to go around it is to give the uterus babies. Yeah. So that's it.
There's another. I don't think I'm missing anything.
Hi everybody. I can see a number of you there. And yes, you're welcome.
Esther Kabiru,
Yeah.
Wamboyo Karuri.
Yeah.
This is a
One
new
from
name.
London.
Yeah.
Yeah.
This is a new one. Ayegbo Roju Bunmi. I hope I've said it properly. Wale, it's a bit of a hard name. Thank you so much for tuning in. But I can see there's a question here. There's a lady called Ruth O'Kelly. She asks, somebody was saying that jumping exercise help in managing fibroids. Is that true?
No. No, they don't. Actually, when fibroids start to grow, they'll keep growing as long as you have hormones. So whether you jump or you do what, they will actually keep growing. Some people, they grow very slowly. Some people, they grow faster. And it is all, much of it is genetic, if it is in your family. And like I said, it is in Black women. No, jumping ropes will not help. Jumping ropes will help with painful periods, because that's part of what fibroids cause, but it will not help to reduce them to grow. That's it.
Hi, Dr. and Tech Guy. Nice to see you. Good info. That's Wamoyo.
Yeah.
I think that's all.
That's it.
Yeah.
Okay.
I think we'll say goodbye.
Yeah.
Okay. It's another question. This is Masinga Premier Hotel. The question is, do fibroids stop growing after menopause?
Yes. After menopause, they stop exactly where they were.
Yeah.
If they were very small, they will shrink. They will turn what is called calcification and shrink. But if they were more than like 5 centimeters, they'll not grow bigger, but they will not disappear.
Mm.
So if they start to grow bigger after menopause, it means they are changing into cancer. And like I said, when one reaches menopause and they still have fibroids, you keep checking that they are not changing into cancer. So sometimes it's wise to not go into menopause with huge fibroids. Sometimes it's good to just remove the uterus. But if you keep your uterus, keep checking that those fibroids are not changing towards cancer. And especially if you ever start to feel even a little bit of discomfort or a bit of pain, because fibroids do not pain.
Ruth Okello was asking another question.
Mm.
She asks, can the position of fibroids prevent conception?
Yes. I had said that earlier. If they're the two things, if they are inside the uterus, then the uterus will imagine that it has a baby already. What is called pedunculated. It's like one puts a coil or something. So if there is inside the uterus, then conception will not happen because that uterus knows it has a baby. It's carrying a baby. That's one way. The other way is that if they are big enough and they are blocking the tubes, the fallopian tubes where the sperm and where the egg goes through and the sperm swims to meet the egg. If the two tubes are blocked, then it will cause a lack of conception, yes. In those two ways, yes.
This is Masinga Premium Hotel again. Says, thanks, Doc. Discuss menopause soon. Very educative initiative. God bless. I think we had already discussed menopause. Yeah. So if you go to previous videos, you should be able to see the menopause video.
But if need be, we will redo it again if we need to. But keep asking for things that you want us to discuss. We shall discuss them. We want people to get knowledge and to make right choices. So girls, get pregnant early before the fibroids come. Thank you.
Okay, there's another question. Esther Kabira is asking, do fibroids add weight or reduce weight?
Hardly. The biggest fibroids we'll get is like half a kilo. So they will not necessarily give you weight. What they'll do is that they'll refuse. They refuse. That is Kikuyu. Yeah, they'll refuse. They'll refuse your abdomen to shrink. So your abdomen will always be bigger, but they'll not. They'll hardly make a weight difference at all. There can be some very huge ones indeed, but the fibroids as per se are not going to cause you a lot of weight issue. By the time they cause you weight issue, they are also sitting on your kidneys, so they need to be removed actually.
Questions, they seem to be coming back. I think now that's all.
That's it.
Maybe we can also let them know that this is.
I think people are going for Christmas, so we shall take a break. We will resume when? Maybe at January, beginning February, depending on how people are feeling. But we shall be posting a few things in the Facebook, in the page. And if you have questions, ask. We shall answer them on the page. And if you don't want to be declared your name, we shall not declare your name. We shall just answer the question on the page. That we shall be doing throughout. But the talks, I think we can suspend them now. People are going for festivities, and Jamhuri is almost here, and Christmas and New Year, and then school fees and starting school. So we will suspend for a while. That's it. We are finished. We say bye-bye.
Kuna C word.
Huh?
What is C word?
Which one?
This is Esther Kabira. I don't know what she's trying to say here. I don't know what she's saying.
Oh, we will be there. We will be here. Okay.
Oh, we will be here.
Yeah.
Okay. Okay, so I think
we are all very welcome, and please give us topics to talk. We need more topics,
yeah.
so let us know which topics are of interest. Sometimes it's just what people ask me in the clinic. I'll soon be talking to the young, the very young, talking about sexuality, talking about sexually transmitted diseases, talking about how to not get pregnant if you must have sex. So we'll expand this, but please ask many questions. Ask what topics you want us to discuss, and we will.
Yeah.
We want to cover every person, from both boys and girls, from age whatever to age whatever, to be informed.
From puberty.
From puberty.
Yeah. Esther Kabiru says Merry Christmas. And Merry Christmas to you all as
Yes.
well.
Yes.
Happy New Year.
Yes.
It's been an interesting year, but we thank God for His grace.
Oh yeah.
Yeah.
Yeah, he is still in control.
He is.
Yeah.
He
He
is.
is still in control. So bye-bye.
Bye-bye.
And thank you. This makes it lively. Thank you very much.
Yeah.
It makes it nice.
Yeah.
Okay.
Also, just to say, please also watch the other videos if you haven't had a chance to watch the other videos, the ones that we've done previously.
Yeah.
Yeah.
Anyway.
They're there. Okay.
All right. Bye. Merry Christmas and Happy New Year.
Happy New Year. Merry Christmas. Bye-bye.